Chamber of Commerce. Welcome to the Business Power Hour. We are excited today to talk to a couple of panelists about the mental health here in the state of Texas. And first of all, I want to thank our presenting sponsor, the First National Bank of Central Texas, and our gold sponsor is Spectrum Reach. Today we are excited to be joined again, like I said, by a couple of panelists. One is Daniel Thompson, who's with our local MHMR, and you can see Daniel there. He'll come on in a second and share a few remarks. He's got some great experience to share with us. He's actually been involved with the state's disaster behavioral health programs in the past and helping design those. So we look forward to hearing what he has to say. And then we also have a special guest with Dr. Liz Varghese, and she is the medical director of behavioral health for the Blue Cross Blue Shield. And she actually lives here in Texas too. She's a converted New Yorker. She got out of there just in time 7 years ago. So I'm sure she's very thankful for that. So Dr. Varghese, I'd love to let you get started here. I know you have a limited amount of time, so we'll let you speak. You got a few slides to share with us, and we will go from there. So welcome to Waco, sort of.
Thank you so much. I've actually been to Waco, and it's a beautiful city. So thank you again for having me here today.
Great.
Okay. So like you said, I do have a couple of slides to share with you. Don't know if it's going to pull up. Wonderful. Can you still hear me?
Yes.
Okay, wonderful. So one of the things I wanted to discuss today, well, a couple of things that's on the agenda is social distancing and isolation and how it's been affecting all of us, sheltering in place with children and spouses, job loss, dealing with the loss of a loved one during these times. These are all issues that have been affecting us all in one way or the other. So just wanted to talk a little bit about everything and provide some best practices around it. Next slide, please. So a few weeks ago, my family and I were out for a walk, and we saw neighbors approaching from the other side, and they were waving hello. And you know, everyone's pretty good in my neighborhood about maintaining the recommended 6 feet for social distancing. And all of a sudden, my 4-year-old daughter looks up at us with this worried look on her face, and she asks, "Are they social distanced enough so we don't get the corona?" I was floored. I mean, as innocent as her question was, I realized to what degree our lives have been altered, and has actually affected us from the youngest to the oldest. And many factors play into the social distancing and the subsequent isolation that we've all been experiencing in one degree or another. For example, now we're concerned more than ever about our own health and the well-being of our loved ones. All of a sudden, going to the store to buy everyday supplies has become like a whole new stressor with the social distancing rules. In my house alone, it's a huge conversation. Who goes to the store? Do we wear masks? Do we not wear masks? And if my husband goes, he's going to buy the entire store. And if I go, I'm going to sit there touching my face the whole time. And then when we come back, do we wipe down groceries? Like, do we have a designated place for it? These are stressful things that we were not talking about 4 months ago. And, you know, for other folks, like loneliness and maintaining a healthy life balance becomes an issue, as does stress management. And all of these aspects in turn can affect our existing physical health conditions, as well as our mental health conditions. And of course, staying healthy during these times starts with taking measures recommended by the health experts like hand washing and social distancing. But maintaining balance in our lives during this time of social distancing is important to keep our mental health in check. You know, while everywhere we look, we have information about the virus. And while remaining informed about the virus is important, finding ways to unplug from news outlets is even more important. Even social media, which can be a wonderful tool to stay connected at this time, can elaborate on the virus, but it can also spread misinformation. And this way, in turn, negatively influence our mood and increase our stress and anxiety. It was mentioned, I'm from New York, so I have several chat groups of friends from New York. I have chat groups of friends from here, and everyone's well-intended, but ever so often someone will send a link on how to beat Corona with so-and-so methods, or did you know this about Corona? You know, it's okay to set boundaries and to plan some time away from it, because not everything that you're hearing is correct. And some of these things can increase our anxiety. Of course, another thing to do is scheduling time for exercise and when appropriate for outdoor walking. In my family, we usually use this time to reconnect. We talk more because we're not distracted by TV or by chores around the house. We use this time for my kiddo to do like a nature walk, find things, you know. So this is an exciting time because more than ever, families are finding time to spend with each other. And of course, other healthy coping strategies for low mood and anxiety can include staying busy and using this time for hobbies that you can do at home. I bought a sewing machine a few months ago. I think it was on sale at Costco. I finally opened it up a few weeks ago, and I started tinkering with it. And I'm pretty hopeful that one of these days, I'm going to make something productive with it. This is also a great time for the home improvement project that you've been meaning to work on. I had my husband caulking the bathroom and the windows recently, and he brought all these supplies 7 years ago, meaning to get to it, but finally he did. And you know, he spent about 2 days doing it. He feels more accomplished. He feels proud when he looks at it. And he's still talking about it this week. I resisted the urge to say, I told you so, because we are sheltering in place. And to my credit, I'm picking my arguments better now. And of course, it's easy to feel overwhelmed in times like this, but it's also times like this when focusing on even the smallest positive things in your life and having a list of things you're thankful for becomes important. Build supports also and maintain relationships by connecting with others. We live in a virtual world right now, and it's easier to stay in touch. Use that to your advantage. Not everybody maybe has access to email, but text, call, if you're able to FaceTime with their loved ones, these are all important, and these will make your mood better overall. Also, many religious organizations offer virtual services, groups, and support. Take advantage of these services and resources online, because there are people that want to help, and there are volunteers in our community ready to do this. Healthy eating will also play a vital role in mental well-being during this time, as certain foods can exacerbate anxiety and low mood. Avoid junk food as best as you can, excess sugar, caffeine, because that you may love that cupcake, but trust me, it does not love you over time. Choose a well-balanced diet as best as you can. Also, practicing good sleep hygiene will help mitigate stress as well. Limit screen time, turn off electronic devices about an hour before bedtime. Have a regular routine for the day, including a time to go to bed. Many people benefit from deep breathing, mindfulness, yoga, meditation. Find something that works for you and then set aside time to practice it. Next slide, please. So sheltering in place with spouses and children are another theme that comes up pretty often, because many of us are at home with our spouses and children, and this can be particularly stressful for even the best of marriages and families. Firstly, recognizing that these are unusual circumstances and there are additional stressors in our lives will be very important. This way, couples can take steps to protect their families. Between homeschooling, working from home, preparing 3 meals a day, and housework, things can become stressful and anxiety-provoking pretty easily. But you know, don't underestimate what you're doing and stay away from comparing yourself to others. These are hard times, and it's important to remember to show grace to yourself and to others in your family. Being in close quarters for long periods of time, for example, it can turn the most minute issues into arguments. Let go of the small things. In our house, for example, it's socks on the floor in random parts of the house. I don't know how it gets there, but it drives me nuts. But lately, I've been stopping these annoyed thoughts and trying to replace them with, how will this impact me and my family a week from now, you know, a year from now? And you know something, it doesn't. And that's why I refrained earlier from the I told you so kind of comments, because it sparks distancing in a different way from your family. More importantly, show grace to yourself. It's okay if the house isn't spick and span, or if every meal doesn't include all the food groups. I'm pretty notorious personally for having, a protein, a whole grain, a veggie. Yesterday, my child ate peanut butter, a spoon of peanut butter and a couple of strawberries for lunch. And you know something? She's alive. She's okay. And I'm okay. But oftentimes we place these expectations on ourselves, and then we find it hard during times of stress to live up to it. And this in turn affects our mood and our self-esteem. And this also cascades into other parts of our lives. Most importantly, when you're at home with your family, practice listening. Hear what your spouse and children are saying. Repeat back to them what you understood from the conversation. So this way they know that you heard what they wanted you to hear. In the event of an argument, or if you've said something that you didn't mean to say, don't be reluctant to apologize. Even for the smallest member of our families, 2 words can go a long way. Remember, you have control over your words and actions, not the words and actions of others. So you want to make sure that your interactions with those around you are positive and productive. And also, let your family members be aware of your own needs as well. Use statements such as I feel, and I need, instead of statements that begin with you, because this is going to cause the other person to become defensive and create more tension in the house, which at this time, frankly, none of us needs. And also with this pandemic, there are also factors building up that can foster violence within our home environment. Violent situations can occur between spouses, and children are especially at risk during this time. So anything that reduces stress in the home environment can reduce the risk for abuse. If you find yourself in a situation where you feel you're being victimized or even hurting others around you, seek help immediately. There are resources available online that you can connect to and they will connect you to therapists, doctors, crisis counselors. You can contact your PCP, psychiatrists, and other healthcare providers. Because remember, you're not alone. There are definitely people available to help you. Next slide, please. So one of the biggest themes surrounding COVID-19 is how our lives have changed and the grief surrounding our loss. Of course, we're grieving many things, like the things that we were able to do before and the things that we're not able to do anymore, the people that we were able to see and we can't see them, we can't go visit our parents, grandparents. But the biggest impact of the virus has been on the economy, and this has led to layoffs and job losses all around the world. It's a huge trauma and one of the biggest causes of stress. Job loss is as bad to some as the loss of a loved one or even a divorce. This leads to financial stressors, and this compounds into other areas of our lives. And many of us identify ourselves with what we do for a living. In my friend circle, we have a couple of Liz's, and they call me Doc Liz, or doctor, and they've been calling me this since high school, So when this is taken away from us, it's possible to lose sight of who you are and your purpose in life. In order to combat these feelings, get in touch with others. Discuss your emotions with family and friends. Hold a family meeting. Discuss how long your financial resources can sustain you. Because realistic conversations like this in the long run helps you to be prepared for what's to come. And surprisingly, this level of honesty also helps children not to be caught off guard and decrease their anxiety. And this also helps them to be part of the process. Also, look into available resources early on. Ask others for help in doing this if you find yourself in a place to not be able to. And of course, if you find yourself turning to maladaptive behaviors like substance abuse or thoughts of harming yourself or others, again, seek help immediately. You are not alone. Seek connections. There are definitely resources available via telemedicine, and there are healthcare professionals available in person for emergencies as well. Next slide, please. So one of the most devastating effects of this pandemic is a loss of a loved one due to COVID or any other circumstances. And losing a loved one is always difficult, but the COVID pandemic has created new and unanticipated complications. Because of our need now to maintain the social distance to reduce the spread of the illness means the way we grieve their loved one will be very different from what we're used to. In my community, for example, 1,000 people can show up to a funeral, maybe even hundreds. But technology actually can play a vital role in helping families and filling this gap by providing closure and time to grieve as a community. I've heard of many people doing streaming services or online gatherings. So this provides a way for families to come together to mourn a loved one and celebrate their lives. perhaps even writing a letter to a person who has just passed, or video chatting with another member of the family and talking about fond memories are a way to reflect on the loved one's life and maintain connections. And of course, again, if you find yourself in any of these situations and you are realizing that your anxiety and depression are worsening, lasting a few weeks, disrupting your functioning in any way, or you are having thoughts of harming yourself, contact a healthcare professional. I know that I'm reiterating this, but surprisingly, a lot of mental health issues that were kind of skimming the surface before are coming into light now because of these additional stressors. And remember, there are many opportunities for online therapy and services as well. And one of the resources that can be used is the Texas Health and Human Services website at hhs.texas.gov. They have a dedicated COVID-19 mental health support line. The phone number is 833-986-1919. And I believe Mr. Daniel is also going to be sharing some resources that are going to be coming up, which would be very useful as well in helping folks get through this. You know, the world has definitely changed, but you will get through this. As a people, community, country, we will all get through this. But know that there are people around you to help you during this time, and you're definitely not alone. Thank you so much for this time for me to be able to speak to you.
Great. Well, hey, thanks for your remarks. Thanks for taking the time and sharing us that great information. And maybe someday you can actually come down from Flower Mound and enjoy Waco in person. So that
I've been meaning to, but we are shelter in place, remember? As well.
How much longer?
No, not that much longer.
Bring your wallet. Take out a bunch
Bring your wallet.
ATM and spend it like crazy when you get here.
There is a bakery there that I've been meaning to check out, so I may take you up on that offer.
Awesome. Well, Dr. Varghese, thanks so much for your time. We will move on now to Daniel Thompson. I'll reintroduce Daniel real quick. He's Executive Director of the Heart of Texas Region MHMR Center, which, for those of you may or may not know, they serve about 10,000 people a year. It's 6-county region with 32 different locations. His agency employs 520 staff. So he's not only in the in this healthcare profession, he's running a 520-person staff business as well. So he can relate to a lot of us as we try to run our businesses. Like I mentioned at the beginning, he's also had some experience in creating disaster plans, which I'm sure he's wondering right now how well his disaster plans are working. So we'll get to quiz him on that. We're going to do something a little different here in this segment of the webinar. Matt Metters and I are going to switch back and forth. Matt is our president and CEO of the chamber, and he's going to be watching. We're both going to be watching the Q&A. So down at the bottom of your screen, you can see an icon you can click on that allows you to ask live questions. So if you want to ask any question of Daniel, just line that up, and we will be looking through those, and Matt or I will come on and ask that question. But before we get to that, let's let Mr. Thompson say a few words and tell us a little bit more about his organization, what they do, and how they're operating currently in this environment. Daniel, the floor is yours.
All right. Thank you, sir. And thank you, Dr. Varghese. I appreciate your remarks. And certainly one of the things that you mentioned, Dr. Varghese, was that there are local agencies willing to help in addition to just the plethora of resources here in Waco. The Heart of Texas Region MHMR Center is one of those agencies that is designed to help during an incident like this. We are one of 39 Texas community MHMR centers that serve the entire state of Texas. We are governmental entities that are designed to provide government-funded healthcare services, mostly in behavioral health or substance use disorder programs or IDD services. And as Rick mentioned, we serve a 6-county region, Bosque, Falls, Freestone, Hill, Limestone, and McLennan County, and we are headquartered here in Waco. In addition to the services I mentioned, we also provide early childhood intervention programs, which is designed for children from birth to the age of 3, general case management, medication management, psychiatric care. We are the conduit to state-funded programs and state facilities such as state hospitals and state-supported living centers. And we have a plethora of professional staff, from psychiatrists to nurse practitioners, speech and physical therapists, direct care staff, counselors, social workers, licensed professional counselors, and other allied professionals. One of the things that people don't realize is that we also have under our state umbrella a responsibility to respond during times of disaster. And Rick mentioned a little bit about my background. I actually created the state's disaster behavioral health program back in the 90s. And over the course of time, that program has written and provided over 100 projects across the state of Texas. And we've also helped out other states and in U.S. territories. And so it is something that folks don't tend to think of an MHMR center doing, but we also do provide services to the general population and individuals that need our services. But ultimately, the Crisis Counseling Project grant that Dr. Varghese alluded to is it's a FEMA-funded project, and it is designed to help keep people out of our behavioral health systems through early intervention. And it is funded through the Health and Human Services Commission. And these are very unique programs. And, you know, we've responded to things from floods, fires, and tornadoes to the A&M bonfire collapse, the space shuttle blowing up over Texas several years ago, Oklahoma City bombing, and even the 9/11 events. So the people who work these programs are very informed about trauma and the effects of trauma. And, you know, one of the exciting pieces about these programs is, again, it's designed for anybody. And with this particular project that is coming up, it will be called Texans Recovering Together. And that's the state brand for the project, and that's how we'll also operate it locally. The entire purpose is to provide individual counseling and group counseling, basic support and education, community linkage to folks who may perhaps need additional help and assistance. And so there's a referral and sorry, I've got something popping up, but there's a referral aspect to it so that we can refer people out to services when they may need more traditional services. And then, of course, if somebody needed our services, we could also arrange to bring somebody in. But ultimately, our goal is to try and keep people out of our system. And you know, with a COVID-19, this is an opportunity, and Dr. Varghese alluded to this with much of her presentation, is this is an opportunity for us to help normalize the emotions that may come with abnormal circumstances. For example, you may have families that they've never dealt with anxiety or sadness or depression, but when's the last time they were also sheltering in place for weeks on end? And it's quite often one of those opportunities to try and normalize this event and help people realize it's not every day that you're fearful of going to the grocery store. That's a very abnormal reaction to this very abnormal circumstance. And so what we do is we work with families or individuals to try and normalize those reactions and help them learn positive coping strategies, working with the families or their children's, or even groups, for example, with our first responder population, or nursing or medical teams that are, having to deal with every patient that walks into the hospital may be a COVID-19 patient. That's an abnormal situation for them, and there is a level of stress and anxiety that's going to be coming with that. So with this Texans Recovering Together project, we will be doing outreach work to these populations, grocery store workers, delivery personnel who are, again, going to people's homes or having customers come into their facilities, and there could be a level of anxiety associated with that right now, especially with the ongoing threat that COVID-19 presents to all of us. In terms of just localized numbers, MHMR is taking care of its general customer base. And we're fortunate that the state and federal government that we work under their auspices have allowed us to move roughly 95% of our services to telephonic or telehealth means. And so that means, we're serving people in their environment. We're continuing with our regular services, but some trends that we are seeing locally is that in terms of hospitalization, for example, over the last month, we've seen a 20% increase in people who present in an emergency room for a behavioral health issue actually being hospitalized due to that anxiety or that stress, whatever the presenting issue is. And based on feedback and just what we're gathering from the data, is that people they're fearful of going to an emergency room, or they're fearful of going out into a public situation and being possibly exposed to COVID-19. So they're waiting longer to seek that help. So by the time the anxiety or presenting issue becomes so great that they actually seek that medical attention, they end up being hospitalized as a result. And so, again, we're encouraging folks to reach out early when they're dealing with some of the issues that Dr. Varghese mentioned, such as, anxieties or depression, being fearful of going out. And when those presenting issues start interfering with your normal life, that's the time to reach out. If you're having bad dreams, or you're finding yourself just days on end being anxious, to engage in some normal activities as much as we can under the current circumstances, then that's the time to reach out so that you can get earlier intervention and that you don't become a part of the behavioral health system. Locally, we have seen just in the past month, 332 people locally who have very specific issues related to COVID-19, and that's a variety of issues that can't necessarily provide all the detail behind that data for privacy reasons, but we are seeing a spike in substance abuse services. We've seen roughly 11% increase in people needing assistance in that area. And then also with older people, we've seen a 13% increase in services by individuals over the age of 65 who are having anxieties or depressive issues. And so, this is something that impacts the whole family, and it impacts our whole community, because again, when you end up having to be taken to the emergency room, it takes up those resources, it takes up law enforcement's resources when they need to respond to a crisis. And so we certainly encourage people to reach out locally and early if you're having these issues, or if you're concerned about a family member or a colleague. A lot of times you may see a friend or a family member that you think now's probably a good time for them to reach out, and they can do that locally. Our local crisis number is 1-800-878-8255. 866-752-3451. Or as Dr. Varghese mentioned, there is also on the Health and Human Services website, there's that phone number, a crisis line, and then there's also an additional number specific to COVID-19, and that's 1-800-985-5990. But I would also encourage folks to reach out locally, because we are aware of those local resources. We have a generalized counseling center where people can get the free help. We can do assessments in crisis triage and crisis interventions also, and those are all free of charge services. So in terms of the FEMA project, we will be hiring specifically crisis counselors and outreach workers. I interviewed yesterday folks for our team management position. And so this is a project that should be with us in the local region for some time. And I'll go back to that number of what we have just seen locally already. That's 332 people within our counties in our region that have sought services without us advertising or without us doing any outreach. And so certainly we suspect that number will be much greater. Because again, as Dr. Varghese mentioned, and I'll mention as well, these are very unusual circumstances, and it's not something that any of us have ever experienced before, or most of us have not ever experienced before. And so there are anxieties that come with that. It's quite normal to feel sad and depressed as a result of these types of unusual circumstances. And again, folks who have lost their jobs, or who are not working, and there's a lot of additional stressors on people, and we just certainly encourage people to reach out or to refer folks to our programs, and we're happy to help in any way possible. Certainly, if you have any questions, please let me know. Thank you.
Hey, thanks for those remarks and that information. I have a question for me, just personally from our business perspective. Have you seen or do you know of any best practices out there for employers as they're trying to keep the morale up in their company, to help people's mental health as they're working? I mean, especially as like the governor talked about yesterday, we're going to start seeing more businesses open. Of course, there's been a lot of them that like mine that are considered essential and have been working already. So yeah, do you have any input on that? Any best practices that we should be considering?
One of the things that we encourage employers to do, and really anybody, a parent or spouses, communicate openly and be real upfront. I try and send a weekly or bi-weekly news out to all of my staff to keep them informed and of what's going on and what our business plan is. And the more you can reach out to your staff and just reassure them, hey, here's what we are doing to prepare for opening, or here's the steps we're taking to keep our staff informed and safe, the better off you'll be. I've seen stories where businesses, as they're getting ready to open, they're putting stickers on the floor. They're showing which, what is the appropriate social distancing spots. Again, it's the lack of information that tends to cause people more anxieties. So the more information you can provide and show them that you are thinking through or seeking their feedback, I think the better off a business will be.
That's good. Hey, Matt, do you have anything you want to add or any questions you want to bring up?
Daniel, thank you very much for joining us. We have not had any questions from our participants, but along the same lines in terms of Rick's question, I'm curious, as we all start going back to work, and Rick's business is an essential business. And so they've been operating. There are a number of us who have been working remotely, and that applies to a lot of companies in our community. As we begin that process as employers, if we see individuals in our workforce as they come back in who they're acting differently, if you will, and you can tell that, there's something bothering them, right? We're not healthcare experts, but you can tell that there's maybe a little bit different demeanor and so forth. I think as employers, we have to be careful, but we also have to care. What can we do? And how do you approach an employee, or how does an employer approach an employees who, to your point, to your presentation, has really been impacted by the COVID-19 experience?
I'll use an example here in my own office. I have an employee. One day a week, I've asked my executive management team to work remotely. And I, of course, not wanting to get into a lot of detail about that, but I had somebody that was wanting to work from home more often. And I finally just had a very gentle conversation. Are you having anxieties associated with being here in the office? And they did present that yes, they were, and it was what you're mentioning. I picked up on the behaviors, and we've made it okay for that person to spend more time away from the office. They're still working every day. They, when this first started, we went through all of our personnel and decided which ones could work remotely, which ones had the ability to work remotely, and we pushed them out to do that. That was to help our own healthcare professionals. And then, of course, the state came along and said, hey, we want everybody to work remotely. As we get ready to start reopening, and by the 18th, I believe, is when the governor said, businesses could be back at 50% capacity. Again, we're working with our teams, and we're being very mindful of, who can come back, and what staff do we have that don't have childcare. Well, there's resources out there, and in fact, I got it from one of the meetings we've been involved in together, where Texas Workforce can help find childcare. That's an excellent resource and available to people who qualify. But I think, an employer just being sensitive to their employees, and I would guess most employers like myself, we look at our employees are our most valuable resource. They're typically the most expensive resource we have. And so the more we take care of them, the less turnover we have, and the more we should be able to help support them. And so I think it begins with just an honest conversation. Now, certainly there's health information you've got to be mindful of. And so I don't want to give people bad advice, but if you notice an employee that you think might need some support, I certainly talk with your human resource office about it, but find the best methodology to approach them, and that's based on individual employees and in the individual's typical demeanor. There are people in your own office that are more easily approachable than others, but certainly it could be something like inviting in presentations or providing brochures about the resources that are available to employees. There may be employees that are not open to that conversation, but yet you could distribute a pamphlet through your timesheets or other internal means.
Daniel, thank you so much for joining us today. We really appreciate your presentation and sharing your insight and helping us understand the infrastructure that we have available here in our backyard. We appreciate the work that you're doing, and we did have one of our participants send a note, didn't have a question, but just wanted to also extend their warmest thanks to you and your entire team and everyone who's working hard to help all of us. So we sure appreciate it. Rick, do you have any questions, or are we good to go?
I think we're good to go. I was going to throw out something. I know I'm no expert here, but one of the things along those lines that I've seen some other companies do that I thought was helpful, and we've tried to emulate here as well, is finding ways to care for employees outside the norm. I mean, so providing, when we can provide PPE for them to take home and share with their family, right? Here's extra face masks. Here's extra sanitizer. We've even looked at bulk buying toilet paper so we can hand it out for the, whatever ways we can ease their home life too. So I think kind of back to your point, as long as they see that we care for them, we're looking out for their best interest, their health and safety at work and at home, I think that helps the overall morale. It seems to have helped around here. So I just wanted to throw that in, Matt.
Yes, sir. Thank
It's
you.
all yours.
I appreciate it, Rick. Thank you so much. Daniel, again, our warmest thanks to you and to Dr. Varghese for joining us today for our Business Power Hour. We appreciate it. And for those of you who are participating today, thank you all very much for being with us again for our Business Power Hour as we continue our Business Power Hour. Express my warmest thanks in closing to First National Bank of Central Texas for being our presenting sponsor, and also to Spectrum Reach as our gold sponsor. I would remind all of you who are participating, and please share this with your peers, that all of our Business Power Hour webinars are being recorded. We have an inventory of them now, really good information that you can go back and take a look at, and you can listen and watch the webinars. And we have a couple more really nice programs coming up that I want to share with you as we make our way to the balance of our day. Tomorrow, we're really excited to reintroduce 1,000 Friends. It'll take place at 10:30. So tomorrow, April 29, 1,000 Friends at 10:30. And then next Tuesday, May the 5th, we have our comptroller with us, Glenn Hager, and Glenn will also have Tom Curra, who is the Chief Revenue Estimator for the state of Texas. And I think everybody's going to be keenly interested in hearing that presentation and understanding early out impacts of COVID-19 on the state's resources. So again, next Tuesday, May 5, Business Power Hour continues. Comptroller Glenn Hager, Tom Curra, Chief Revenue Estimator for the state of Texas. Folks, we sure appreciate everything you do for your chamber. If you need us, please call us. Have a great day. Thank you.